Hi, I'm Alex Hale, and at this point it doesn't really seem like I'm ever going to leave Marist. Today we're going to talk about, you guessed it, Bloodborne Pathogens. Welcome to our poorly titled presentation, Bloodborne Pathogens, and you. Now, I'm not going to lie, I'm sorry you have to sit through this presentation. There's probably better things you could be doing, but maybe not, because the things you learn in this video could potentially save your life and the lives of those around you. I promise I'm not going to show that again. I lied! So without further ado, let's get into what bloodborne pathogens really are. Essentially, they are microorganisms that are invisible to the naked eye that live in blood and other bodily fluids. Some of the most common ones are hepatitis B, hepatitis C, and HIV. That's the virus that causes AIDS. Other ones include hepatitis G, parvovirus 19, and cytomegalovirus. Of course, the most common ones in a school setting are going to be hepatitis B, hepatitis C, and HIV. So, how are bloodborne pathogens transmitted? Well, in general, through unprotected sex and by sharing drug paraphernalia. In the school setting, however, infection most often occurs when someone touches a contaminated surface and then touches their eyes, nose, or mouth. Consequently, scenarios where infection are most likely include sports injuries, accidents, and fights that lead to bleeding. As a result, those most at risk for infection include sports and athletic trainers, first responders, nurses, custodians, and the dean of students. So how does one avoid infection? Well, the easiest way is to live and work under the assumption that everyone around you is infected and protect yourself through the following three ways: immunization, barriers, and treatment. The immunization process for hepatitis B is a series of 3 injections covered in cost by the employer to at-risk employees. If you wish to decline this immunization, you must sign a declination form. But you can always change your mind and accept the immunization later. The most common type of barrier is gloves. In the event of an accident or other scenario, instruct the injured to try to stop bleeding on their own by applying pressure to the wound. If they do require further help, always put on gloves first. Gloves and other barriers can be found next to the AEDs in Woodruff Auditorium, the clinic, the cafeteria, and the stadium ice room. They're also available in first aid kits located in all of the classrooms. If you can't get to a pair of gloves, other barriers, like a plastic shopping bag for example, can be used. The important part here is to protect yourself from contact with another individual's blood or bodily fluids. Following a situation where bleeding or the possibility of infection from a bloodborne pathogen occurred, always remove your gloves and dispose of them, making sure to flip them in on themselves and not touching the outside of them. After that, wash your hands for 10 minutes with soap and water. If soap and water are unavailable, you can use an alcohol-based sanitizer instead. In the event that you believe you've come in contact with a bloodborne pathogen, it's important to wash the exposed skin for 10 minutes. Likewise, mucous membranes, your eyes and nose, those should be washed for 15 minutes. In the event of a major exposure, it's always important to contact a professional immediately. A major exposure would be any that include the following. Number 1 would be exposure from someone known to be carrying a bloodborne disease. The second would be exposure to a large amount of blood or other bodily fluids. Number 3 would be exposure to broken skin, and number 4 is exposure to your own mucous membranes. That said, it's never a bad idea to contact one of our clinic staff if you ever worry that you might have come in contact with a bloodborne pathogen. First off, all needles, knives, scalpels, and the like should be disposed of in the sharps box located in the clinic. Additionally, broken glass should be swept up with tongs or a brush and disposed of as well. Clean the contaminated area with soap and water until no visible blood remains. Then disinfect with an EPA-registered tuberculicide such as Whistle. Whistle is kept in the clinic and is also available through housekeeping. Heavily contaminated items, such as those soaked through with blood or other bodily fluids, should be disposed of in red plastic bags that are available in first aid kits and also in the clinic. The clinic will dispose of those red plastic bags. well, you survived. OSHA is proud of you, and so am I. It's our hope that this video was able to educate you on some of the risks that go along with working in an environment such as a school. And while they are substantial risks, they don't have to be when you put the right knowledge to work. If you have any questions about anything you've learned today or anything in the future, you can always stop by and ask any of our clinic professionals and they'll help you out. I'm Alex Hale, and you just survived Bloodborne Pathogens, and you.